Hi, and welcome everybody. I'm Dr. Jessica Drummond, and I'm here today with Dr. Juan Michelle Martin. And I'm so excited to talk to you today about your journey in the field of women's health and wellness, because as a physical therapist, there are so many paths and options that you had the opportunity to take along the way. And you chose the path you chose. So I would love to hear the story about how that started and how it's going.
Yeah, thank you so much for having me. Always a pleasure chatting with you. I think when it comes to my journey, it was really one that was pretty organic and manifested along the way based on where I was at in my life and kind of what I and or my family needed at the time. As with most PTs, started out with that big ortho goal. Yes, I'm going to work with all the athletes, primarily because I was one myself, having played overseas, collegiate athlete, coaching, all the things. And so that was where I wanted to be. And by the end of PT school, because I was also an athletic trainer, I was like, I don't know how I feel about this traveling bit. So maybe we'll rein it in a little bit and just do general ortho or whatnot. And in that experience was exposed to pregnancy, postpartum care, and so on, and loved it and started working with those individuals straight off the bat.
Mhm.
And then started seeing a lot more complex cases over the years, like the next couple of years. Funny enough, when I moved to Atlanta, shortly after I moved, I was working in a practice. I was a director for a practice that was adjacent to a trauma surgeon.
Mm.
We got all the broken folks, all the falls, car accidents, ATVs, skiing accidents, and just about everybody had a fractured pelvis. So I actually was seeing non-op and post-op pelvises, hips a lot. And what intrigued me was the complexity of it, because it's one thing to break a bone, recover from that, or have a surgery, ACL, whatever, recover from that. But with a lot of the pelvic fractures, it was I can walk, I can go back to doing what I'm doing, but my life is only about 80% of where it was because I've got these other things here. And it was these other things, the issues with sex, the persistent pain in that area that kind of nobody acknowledged because the doctors were saying, but I saved your life. I fixed you. That was what intrigued me to get onto this pelvic health path. And so I did. And via a number of different instructors, via a number of different teaching platforms, and just building and building knowledge and reading articles and learning and just being open to learn and grasp. And so that was where my journey started. And I thought I was going to do it exclusively in like, I was intrigued by peds because I was like, oh, pediatric pelvic health, yay. Because at the time I also had little ones. But I also was very mindful of what my experience was for my very first delivery, that just hospital experience. And while mine was not as I won't say it was traumatic, I would say mine was more frustrating.
Mm.
It that no one wanted to listen, and I felt like I had to keep fighting with people to ultimately get what I wanted as far as the experience. But it really showed that there was a lack of knowledge when it came to pregnancy, birth, that kind of thing. And then the postpartum period was like big eye opener in and of its own. And so it just evolved from there. And then the more conversations, because now you're a mom. Like when you're not a mom, you don't have mom conversations. You just don't. Like
Right. You
they're
don't
never
know.
something that come up in your world. Then as
Mhm.
soon as you become a mom, it's amazing. You have now all these mom friends. It's amazing the conversations you have at the playground and on play dates. And all these things not related to kids start coming up in conversation. And you're like, uh-huh, well, that's interesting. And so I recognized that there was this big need to have more information, be more transparency about things that can be done, and just overall guidance. And so that was my roundabout way of really diving into the pelvic and women's health world.
Yeah. So, in talking to a number of our other graduates who have made this transition from clinical healthcare in a hospital setting to starting their own practices in a number of different, those looking like a number of different things, there's this idea that essentially the hospital healthcare that we have in most of the Western world is crisis management. Like you said, it's like, I saved your life. You can walk, like, good enough. What are you
Mhm.
complaining about? There's not so much a conversation on quality of life, which also is really important because it impacts relationships and your ability to go to the bathroom and your ability to have sex and like all these really basic life functions, but they're not survival. So it's not like an acute crisis necessarily. But in that person's life, it can feel like a crisis because of how it impacts their day to day. So now you're hearing these on the ground conversations among your mom friends. And so then is that the time? So now you have little kids, you're at play dates. Is that the time when you launched your private practice?
Yeah, so I actually started back in 2016. I was looking for just more autonomy with regards to my schedule. Kind of didn't know specifically what I wanted to do. Felt like I would do some pregnancy and postpartum work, but I really loved kids as well. And
Mm,
so I did some contract work in peds, and that was the start of my practice. And then I started doing home visits for pregnancy and postpartum. And this
mm,
was like 2016, like late 2016, early 2017. And I started doing that, kind of no blueprint per se, because the only home health that was happening was the home health that you get out of the hospital when you have the surgery or something. And so that was where I started at. And I loved it because I could work my schedule around my kids' schedule and around events they had at school. And that was where it took off. And so, again, it was one of those things where it just really grew out of what I needed. I needed flexibility in my schedule. I had at the time a 3 year old and 1 year old. So I needed flexibility in case somebody got sick, in case there's an event at school, because Lord knows, like, you got an event on Thursday and they don't tell you till Monday, and it's at
right.
10 o'clock in the morning because, of course, parents have nothing else to do. So,
Right. Right.
oh crap, now I got to flex my schedule a little bit. But it was great because I wanted to be involved in what they were doing, and I still wanted to have the option to build a career.
Yeah. And so at that point, a little bit after that, you started getting the coaching bug
Mhm.
and you joined our program. So tell me a little bit more about what you were so curious about when it came to coaching and why you decided to take the leap to add that skill set, because it is really a different way of approaching things than just having that clinical perspective, that physical or occupational therapy perspective where you're coming in to fix a problem. It's a very different perspective from that. So what made you curious about it?
So, a couple of things. For one, I really wanted to embody a much more integrated and holistic care approach. I
Mm,
didn't want it to be like the very clear cut medicalized, because the reality is, when it comes to incontinence issues, when it comes to sexual issues, when it comes to relationship issues, those are the things. It's not like, okay, your knees lacking this amount of range of motion, let's get you doing this, like clean cut, clear as day. It's they come in, you might have to dig a little bit because it's not like they're necessarily always forthcoming. There's
mhm.
going to be some tears shed. You got to pass the Kleenex. You got to wait a while. It can take some time, but it's
Yeah.
really finding a way to create safe spaces, finding a way to really, even though you're working on the physiological things, to make sure that the whole person is taken care of. And you were one of my sheroes too. Like, I was following you, I'd seen you, and I was like, I like what she's doing. She's doing her own thing. I like the rebel approach. I'm like,
Yes, yes. Thank
she's
you.
going against the grain. I like her. And having then hearing either via webinar, and then I finally got to hear you in person in 20, I think it was 2018. So that kind of cemented it for me. And I remember, I think the first thing I did was the functional nutrition.
Mm,
And that kind of blew me away because a lot of the times people were coming in and they're having chronic pain. And I started changing some of the things that I focused on. Like, let's talk about your nutrition.
mhm.
And I was amazed because it wasn't really a major part of the subjective in the
Mhm.
past prior to that. And now that I was asking this question, sometimes in my mind I was going, well, no wonder you're in pain. You eat like crap. It's like,
Right.
and you
Chick-fil-A
had
is
said
your whole
something
diet.
one
Yeah.
time. You said something one time like you can't out supplement a bad diet or something like that,
Mm.
because then they tell you that they went to the chiropractor and they got these 50, 11 supplements and then they don't know how to take them. So then they weren't taking any. And I was like, I was really blown away by that portion. But then also the reframing or restructuring of an intake process to where it is less clinical and it is just very much more person centered,
Mm.
life
Yeah.
centered.
Yeah.
Like, okay, so you've got this hip problem. Tell me a little bit about what's going on with you. Because anybody can come in with a hip problem, but how is this affecting you and why? What is this taking away from you that matters most? So then it got into a little bit more of the motivational interviewing and like the strategies to create space for these individuals to really just share what was happening, right? To create that container for them to share what was happening and how it was affecting them, and then how, what, where they saw themselves or where they wanted to be, right? So it was more that, well, I'm not going to be the one to do something to you. I'm going to be the one to walk alongside you in this journey. And that really meant something to me. I value that a lot more than what the traditional way was.
And so, how did it change your business? Because now you're really on a deeper journey with your clients. You're still doing essentially home health for the perinatal period, but you're getting to hear deeper stories about their birth experience. You're thinking of their clinical challenges or their pain points, their literal physical pain points in a much wider context. So did it change anything about how you did your business or how your business grew?
Well, definitely in terms of the approach, it wasn't more or less selling therapy. And it wasn't more or less like, all right, so you have this pain and we're going to fix that. Or you're peeing your pants and we're going to stop that. Like that kind of was a given. But it was more or less like, we're focused on helping you to have that lifestyle that you want. Like, so
Hmm.
even after the leaking stops, that might not be enough. Because sure,
Right.
you're coming in. And that's what I was finding with a lot of my clients too. They come in and primary complaint, intake and subjective. Oh, I've got this leaking. I just want this leaking to be done. Now the leaking's gone. It's only been 2 sessions. So tell
Mm.
me now what's going on with you. It's like, well, I really want to do this. Or I really want to get back to this. Or I don't know how to do this. I don't know how to start this. And it was being able to help them, guide them, challenge them, support them in ways that kind of help make their lives a little bit more meaningful, right? Help them create strategies for things even outside of the physiological. Help them with regards to some of the relationship concerns, because now we're taking a deeper dive and a different approach. So I think what it did more than anything was create a much more well-rounded practice.
And so you're working with people longer. You're not having to like chase down 100 new people with incontinence that you can
Mhm.
easily, help them resolve. But then you're working with people longer. There's a little less quote unquote selling PT time because I think there's so many other levels. Then they're going to start talking to you about their sexual dysfunction. They're going to talk to you about the mountain climbing they want to do, not just be able to sleep through the night without peeing. They want to be able to lift their kids and go roller skating and whatever it is. And I think that allows us to have, from a business standpoint, it's, you've got more longevity with your clients, but it's also, in my opinion, more fun. Did you find that
Mhm.
like you get to know these people?
You get to know people. You get to
Yeah.
know people. And it's like you said, it's not having to chase down. I never, I don't, I didn't leave a mill to become a mill. So I didn't
Right.
want to chase down a ton of people, but it did help to deepen the connections that I felt like I had with my clients. I feel like because I'd have people who now they keep coming back. Baby number one, baby number two, baby number three. We're not even having a baby, but I'm just coming back to see you because maybe we want to have a baby in 2 years. Like, hey Jay, it's been a long time. How you doing? Fix
Mhm.
me. What's going on? Nothing,
Yeah.
but I just need you to make sure that I'm fixed so that when I go into this situation, I'm good.
Yeah.
But
I'm
really create
resilient.
a lot of that.
Yeah, resilient and strong for the
Mhm.
next phase, whatever it is, pregnancy or not.
Yep.
And so when you're working with people over the long term and you have those deeper relationships, do you find that your marketing is easier because they're referring people, they're coming back? It's just less work for you to have to go out and attract clients, if you will.
Yeah, and for me, one of my things was more to hit the ground running in the community. When I started reaching out to people in the community. I didn't want for my practice to be dependent on the physician next door. I
Mm,
didn't want my practice to be I wanted my practice to be like a community name. Like I wanted people to like, oh yeah, go to Jay. Like, go
mhm.
see Jay. And if Jay can't help you, Jay will tell you where you need to go. But have that word of mouth, that more organic growth. And that's where I've been. So a lot of the times when people come in to see me, it's like, well, who's your doctor? Well, I don't have one. Oh,
Mm.
well, how'd you find out about me? Oh, well, I was talking to such and such said to go see you. Okay.
Yeah. So you're not dependent on that sort of medical model of you need a referral from a physician, because not only did you immerse yourself in the community that you actually live in, but you had the coaching skill set to deepen the relationships, deepen the work you could give to the clients. And when you're starting out, I think a lot of times when people are starting out in their women's health practices, they're very worried about the marketing piece and talking to enough people. But I think what you've demonstrated is that kind of early, like a wider, stronger foundation with the first 5 people, first 10 people that you work with starts to then exponentially grow because they're each telling 5 or 10 people and they're talking to them in that same way that you're talking with them. They're
Mhm.
talking to each other in moms groups and with their coworker who just had a baby, like that. Those mom conversations are very organic because everyone wakes up as a new mom or is in their second trimester of pregnancy or whatever and is like, you really don't research that until you get there.
Yep.
And so
Don't
it's
know
always
what
this,
you don't know.
so it's such a surprise. You're like, what the heck? And I think we see this in a lot of niches in women's health because it's talked about more, but even if it is, you're not really listening to those conversations if you're not in that phase of life. So we're seeing
Mhm.
the same thing in perimenopause niches or any dysfunction. Even if it's more well aware, there's more conversations about it on social media or whatever, you're not thinking about that individually unless you're going through it.
Yeah, for sure.
So I think that was a very smart strategy to, instead of get too obsessive about marketing tactics, because a lot of people go down that road, they take a lot of marketing courses.
Mhm.
Instead, you really deepened your coaching and clinical skill set and then use some very fundamental marketing skills that we teach that allow you to build a strong foundation that then continues on because you're well known within your community and you have a strong reputation,
Mhm. And
which
it's interesting is too, starting out because there weren't a lot of, especially for cash-based therapists,
Mhm.
2016, 2017, the cash-based therapists that were out there. And I'm not
Mhm.
saying that there weren't more. I mean, you were one, um, but you were one of the few females because it was
Yeah,
very male driven in PT, right? And
true.
you didn't, even though there were females out there, you didn't see them. Like they weren't prominent in social media and open spaces and that magnitude. But the approach was very different. Like the hard sell, it, some things will work for some people and some things will work for other people. And what I recognized for me personally was that the approach of a lot of others was not something that felt. And that's why kind of getting back to the community and a lot of the stuff that was taught was reviewed within the coaching program made sense. It wasn't, well, you need to have this big following and you need to have this and you need to go do this and you need to market this and you need to have this funnel and da da da. And it's like,
Right.
oh my God, what
Right.
is a funnel even? Right?
Right. Right. What
So
is a
you
fun?
like, it's not all of that. It's okay. Who do you want to help?
Yeah.
What does that look like? How do you want that to look in your life? How do you want your business to be? Like, and starting from what is it that you want?
Yeah.
Okay, now who are the people that relates to? Now let's pair the two together. And
Yeah.
so I found that was more what I wanted.
And to me, it's so important because one of the things about our program is that primarily the practitioners in women's health, almost exclusively, are women.
Mhm.
And so if we create a kind of business for you and with you that serves women, but you are like at the edge of burnout all the time, we're not actually helping women's health. We're just
Yeah.
creating more anxious, productive women's health practitioners who are also women and moms and working
Mhm.
moms and trying to demonstrate healthy womanhood to the next generation. And so I think it's really valuable that you took the time and space to say, okay, what do I really want? And you were in a very challenging phase of life that so many women go through. You've got two toddlers and since you've had another baby, right?
Yeah, there's another one. What's one more?
What's one more? I mean, once then the only thing my husband always said about that was because we have two is like, oh no, then you go from man to man to zone, and I can't take
It's something, I'll tell you that. So, but we're hanging on.
That's great. That's great. And so you were literally in it in parallel with your clients. And so having our community allowed you to create the kind of business that wasn't going to, as you said, like go from one mill to another mill where you're just like doing something different and you have a more flexible schedule, but otherwise you're exhausted.
Mhm.
That thoughtfulness in the beginning is so important, not just to understand, but to really apply. And you've grown so successfully from that. That was 6 years ago. And now, so well known as a leader in the world of obstetric physical therapy, postpartum physical therapy, teaching all over the world. I know you just got back from India and doing it in such a way that is fully holistic for your clients so that they're not just getting a treatment solution for their incontinence and then moving on, but really going deeper for a lifetime of almost a primary care level of support that just doesn't exist within the crisis healthcare system that we have.
Yeah.
Let's switch gears just briefly and talk about this maternal health crisis that we are having in the United States. The United States has the largest maternal death rate of all industrial countries, and it's 3 times or more worse for women of color. What are you trying? I know that your practice is actively helping to solve this problem. And how do you think the rest of us could get on board to help? And what have you done that's been successful?
So definitely we've got a big problem. We've got a really severe problem. And while I love that now more people are familiar with that stat of 3 times higher for Black women, what I like to let people know it's as much as 12 times higher because it
Mm,
varies from place to place. There was a study that came out, I believe it's 2018, out of New York City, and New
mhm.
York City was like 12 times higher
Wow, that's
in
amazing.
within the metro area, within the boroughs. And we look at things like systemic bias, we look at things like provider bias, we look at just the structure of the system. And realistically, I think until we there are great physicians out there. There are great practices out there. But until we by and large dismantle the current system, we're just plugging holes. It's like
Mm,
plugging holes in a ship that's going to sink or is
yeah,
sinking, and it's only going to do so much. I think for us as clinicians, really, it gets back to educating people. It gets back to one of the things that I do try to do is whenever I can, definitely networking within the community. And whenever I can, is making sure that I'm available in the sense of workshops or educating, because not everybody is going to be able to come to a cash based physical therapist like myself. So when
of
I
course.
can do things that help and fill those voids, then that's going to be that is crucial. So educating within our communities, making sure that we are familiar with the providers out there, who are the midwives, who are the lactation consultants, what is it that people need, who are the other birth professionals, right? And so we can then act as a liaison, like getting people the resources that they need. Well, here's what can be helpful
Mhm.
on that journey, right? Painting the big picture and kind of plugging in the team members where they are appropriate so that people know. A lot of times, for example, I might have somebody come in postpartum. and they've never had any education, never heard of childbirth educators, never heard of
Mm.
doulas, never heard of any of that stuff. And they're coming in and we're addressing issues. I might have somebody come in because they've got clogged milk ducts and they've got a lot of pain. I'm doing ultrasound, lymphatic drainage, whatever, but they've never heard of a lactation consultant and they're having a terrible time. We're talking about things like their overall wellness, nutrition, managing stress, different things like that. I've got a really dear friend of mine who's doing a lot of work now with monitoring, remote monitoring of
Mm.
vitals for pregnant women so that they have some sort of objective data that they can also take to their providers. And so when something comes up, when something doesn't feel right, when that mommy instinct is going off, that they're not just allowing somebody to dismiss them, but they can say, hey, here's what's happening. Take a look at this. So I think really one, getting into our communities a little bit more, finding out who the key players in birth are, finding out what they need, right? Like
Mm.
I can't do everything, nor do I want to do everything. I'm just not that type of person.
No, of
Just
course,
like,
of course.
so,
Yeah.
so how can I help? What is it that you need from me? How can I help you? How can we do this together? Because we can get a lot further together than we can by ourselves. And that in turn helps those within the community, the moms, the pregnant people who are going through all of this and need us. I think as far as the providers go, educating the providers, every day I still hear people say they never heard of pelvic floor physical therapy. And these are physicians,
Yeah.
right?
Yeah.
They've
Yeah.
never heard of pelvic floor physical therapy. And it doesn't have to be a hard and fast, well, we got to do a lunch and learn, or we got it, but form organic relationships even within your community.
Yeah.
Talk to people. Doctors are people at the end of the day. They don't know what they don't know, right? They
Yeah.
do a lot. But, and I'm sure they don't wake up in the morning going, okay, I'm going to mess somebody's life up today. But
Right.
they don't know what they don't know. So, how can we now come alongside them and say, hey, you're not in this by yourself. I'm here to help support the people that you have. How can we do this together? And starting to connect with them and the midwives and different people like that, starting to connect in smaller areas, even in the hospitals, because sometimes in bigger cities to get into the larger hospital systems may be a challenge. But how can you get into the hospital systems? I
Mm.
remember in 2018, end of 2018, I started teaching in the childbirth education class at one of our local hospitals.
Mm. Yeah.
And it was funny because the labor and delivery nurse, when I asked her, I said, hey, tell you what, can I just come in, do a talk on pelvic health? She's like, well, we really don't have much time. I said, well, you know what? Tell you what, how about we trial it, see how you feel, and then let's go from there. And as I'm talking, at the end of it, she goes, oh my God, I did not know all that stuff. We're going to
Yeah.
have to talk some more. Can you come back again next month?
Yeah.
And then I was a regular fixture. And this
Yeah.
is like once a month, every month they had the full day 9 to 3 childbirth education, and it went from being like a little 20-minute block to like, all right, Jay, the whole hour and a half is yours, and we're talking, and I come in and I bring samples, and you got the moms, you got the dads. So now you're not just educating the moms, but now we're educating the dads because they don't know. And if you, I mean, half of them used to be like, whoa. And I remember the
Yes.
first time one dad said, so do men get pelvic health? Absolutely. And so because we were having the sexy time talk. And I told them, I said, dads, you can get a lot more with honey than you can with vinegar, okay? Okay.
Right.
It's sweet. It's not about what the doctor says. You need to be connecting with your wives and knowing what's going on. But it's like those types of conversations that were meaningful and impactful. And so
Yeah.
get into your communities, doing things like that even, it can be so helpful.
And especially because most women are not going to have the luxury of a really skilled doula right by their side to be advocating when their blood pressure goes high or
Mhm.
they feel a lot of these actual causes of death are just things that have been brushed off like,
Yeah.
oh, it's okay, or this bleeding is fine. Meanwhile, the woman 2 hours later is hemorrhaging to death when
Mhm.
because no one feels empowered in that moment because, I mean, anyone who's had a baby, or at least this was my experience, in that moment, you don't feel empowered. You're super busy, like
Mhm.
just getting through it.
Just tired. It's so much going on. And then
Yeah.
that's the thing. And their voice isn't heard.
Right.
And it's
Right.
unfortunate then that the persons who are charged with hearing those voices, they don't.
Right.
And I oftentimes will tell people you can't get mad because we think, oh, well, the nurses should know better. I'm like, again, people don't know what they don't know.
Yeah.
And in a system, they were trained in a system that was designed that way. So what is this lowly nurse going to do if she's like, well, I can't really speak up because my job's on the line and I've got mouths at home to feel, and they feel they themselves don't feel like they're empowered because
True.
maybe they also don't have the support of their hospital system, that if they have to say, listen, this is not working, or I'm here to report this, they don't feel supported enough. They might feel like they might be blackballed, or the physician. So we've got a lot to do on that end, and that's going to take a whole lot of stuff. But at least if we can, at the grassroots level, start getting to the patients first, start getting to the community providers, and then start moving up the chain, I think we can do a lot of amazing work.
And empowering the birth partner, whether it's the father or a family member or
Mhm.
friend, even if someone doesn't have a doula, they have an additional voice that, maybe will keep
Yeah.
pushing. Because a lot of times it's, as you said, it's just an issue of not being heard, not feeling empowered to take decisive, strong action.
Mhm.
Because if it turns out to be nothing, which it might be in some considerable number of cases, but it's enough of a significant problem now that on an individual level, you do want people confident to have someone there to advocate for them. And I
Absolutely.
think that little slice of birth education gives them confidence in you, gives them a resource to ask. And even with the follow up, because it's not always the case that people die like in childbirth on the table, it's a week later at home.
Mhm.
Yeah. And when you're doing postpartum recovery work, that's where coaches are going to be there as a
Mhm.
postpartum health coach, as a postpartum doula, as a postpartum midwife, as a postpartum physical or occupational therapist or acupuncturist. You're going to be seeing these patients longer and deeper, as we talked about earlier, than their 6-week gynecologic checkup, which is fine, but it's not
Mhm.
really, they're not going to be comfortable enough. They're, depending on what day it is, they might not have slept the night before. There's so many issues that I think if we have the opportunity to get out in the community and build these micro practices, even if they're never scaled, even if there's 20 individuals like you who are deep with 100, not even 100, 25 to 50 people a year, that's what really saves lives, because we're going deep, not superficial and wide. So I really appreciate that work that you're doing. And I love that it's been really fascinating to me to talk to so many of our graduates and see how much their businesses really parallel and are inspired by their own life story.
Mhm.
And just the simple desire of working moms to have autonomy and flexibility. It's really that simple,
It's
that this,
priceless, really.
yeah, I mean, this career, like my oldest is now in college, and I just feel so grateful that I had all those years just being at the bus stop or being able to go to the performance or the game.
Mhm.
And I think that's one of the most beautiful things about this kind of work. Thank you so much for sharing about your work. And I have two things I want to wrap up with. As we build out this podcast, I'm going to be asking some of our experts to answer some questions posed by our earlier guests. So if you had the opportunity to ask someone who's a little bit ahead of you, or a peer or a colleague in this women's health practice journey, what question would you ask them?
All of my questions these days revolve around food and recipes.
Hey, great. Any
So it'd be
meal
like,
prep? How do
I'd be
working
like,
moms meal prep?
listen, let's talk meal prep, right?
Yeah.
Yes, it probably would be that.
I love that, because the reality is we're still working moms and we're
And
still
yeah,
looking for those little time-saving tips.
yeah, that is my struggle. It's like, I told someone the other day, I was talking to a patient, I said, the biggest lie ever sold was adulthood. Like, if I knew I had to wake up every day and figure out what everybody was going to eat every day for the rest of my life, I would have passed. I would have been like, no, I'm good.
Yes.
Teenage years are good. We're good, right? But it's crazy.
Yeah, I have to say, I have started my 13-year-old meal prepping just for herself, because like you said, I'm tired of making people's lunches and stuff. And I haven't really done that forever, but it was always like still a day-to-day conversation of like, what are we doing now?
Hmm.
And so now it's a job for her and my husband every Sunday to prep that. So I've delegated that, but just internally.
It's good. I might get the 10-year-old started early.
Yeah, I mean, they've been making lunches for years, so she can do it. And then the final thing I want to end with is, as a person who has been very successful in your business and just really defining your own path and living into it, what's one piece of advice that you would like to share with someone who might be a little bit behind or parallel you on this journey?
Do what fills you, what brings you joy, what makes you happy. Do not go chasing after somebody else's dream because it is not yours. It may look great, but it is not your dream. The most fulfilling thing you can do is being on the path or the journey towards the things that bring you the most joy and form your business around that.
Excellent. I love that. Thank you so much for sharing your time with us. And I am so glad to just hang out with you again, and we'll talk soon.
Awesome. Thank you so much for having me.
Thanks.